Unreported tests were completed as far back as April 12th. For more on this, let's be joined by Professor of Law and Medicine at University of Ottawa, Amir Attaran. And thank you very much for joining us to talk about this. And Amir, especially on the heels of an article that you wrote where you essentially said Canada is bungling this. So when we hear about all these unreported tests, how concerning is it in terms of getting a control of this disease?
Well, I mean, you don't need to be a specialist to answer this. There are reports from a laboratory showing whether persons have been infected by a potentially deadly disease that is spreading in the community. Some of those reports date back to April 15th, 12th, as you said, April. And the reports have just gone missing until today in June. I'm shaking my head. I mean, this does not meet even the most rudimentary notion of competence. The Ontario government is simply incompetent if it cannot get test results on a deadly disease to people who need the result in under a month and a bit. It's shocking.
And part of what you've said was also just in terms of the logistics of getting this done, that's being bungled too, and that information is being kind of scattered or delayed. You even pointed to the use of a fax machine.
The fax machine in the year 2020 is the way the public health departments in Canada mostly communicate. That's how they send information on who's got a case that's positive to somebody else to follow up. It's a fax. It's not an email. That is very seldom used. We are stuck in the fax age in public health. Can you believe it? Except it's so much worse than that the Public Health Agency of Canada says if you are sending a case report to them by fax, you should send an email announcing that the fax is on the way, but don't attach the document to the email that you're faxing. They want the document by fax and an email announcing that the fax is coming.
Ontario particularly has said a lot about testing, complained a lot about the rate at which testing is done and contact tracing after that. But a lot of people would be quick to ask questions about if this happened here in this facility, 700 tests, what about the confidence in the system elsewhere?
I don't have confidence in Canada's public health system. I mean, if we're stuck in the year 2020, shuffling time-sensitive, critical, life-saving information around by fax machine, because there is no electronic data system, then with all due respect and all the agony I feel in my heart as I say this, Canada is a backwards country. Because when I worked in public health in projects in Southern Africa about 20 years ago, we didn't use fax machines. We used email, and that was Africa 20 years ago. This country has simply failed to modernize public health in any meaningful sense. And there is a reason why, for the same virus, we have over 7,000 deaths while Australia has barely 100. We have 70-fold more deaths than Australia. It's not because we're close to the United States. It's not because of travel restrictions. In fact, in mid-March, Australia and Canada were tied for the number of cases. We were tied just in March. And since then, we've gone separate ways because we do not have a competent government, or governments rather, in charge of public health in many parts of this country.
Well, let me ask you about, maybe even a specific or two as to if we were tied with Australia, what did they do right?
First of all, they solved their federal-provincial problem. Australia is like us. It's got a federal government and state governments, and they call them states instead of provinces, but same idea. And very early on, they all signed it should be who the federal government would pay. Here we are in June. Prime Minister Trudeau has never even talked about such an accord, much less making it happen. Likewise, other federations have been proactive. Switzerland, a federation like ours with cantons instead of provinces, made use of federal emergency powers in March. Here we are in June. The Prime Minister hasn't done it. If we are going to accept a reality where yesterday Quebec had half as many deaths as Australia has had since January, one day in Quebec, half as deadly as Australia for the last 5 months. If we're going to accept that reality, fine. But we should do so knowing the reason we are in the reality, and that is the failure of governments, federal, provincial, everywhere. And I'm afraid that's one of the saddest things about our country right now.
Amir Attaran, we're going to have to leave it there, but I certainly appreciate your thoughts and thank you for standing by with us. Appreciate that. Have a good afternoon.
You too. Take care.
Coming up.